Welcome to New York-Presbyterian, Queens. We are honored to care for you and your baby. I'm Ashleisha Dial, and I'm here to introduce you to a wonderful video that will show you the process of having your child here at our hospital. Except we made it before the outbreak of the COVID-19 virus, so everything is a little different now. Our staff in maternity will be wearing a face mask and eye shield at all times. When you arrive, we'll provide you with a face mask and ask that you wear it at all times. Every mother will be allowed one support person. That support person will be allowed to leave and re-enter. However, there will be health screenings periodically throughout your stay. With few exceptions, all mothers will be tested for the COVID-19 virus on admission, because many symptoms of labor mimic those of COVID-19. We understand these changes can be a bit difficult for you and your loved ones, but we've initiated them to protect your health, the health of other new mothers and babies, and our staff. We're all in this together, and the safe delivery of your new baby is our top priority. Join me now on our tour.
Hello, I'm Dr. Daniel Skupski, and I'm the chairman of Obstetrics and Gynecology at New-York-Presbyterian, Queens. Thank you for joining me for this introduction to our team of dedicated doctors, nurses, and professional staff. You can be confident we are all here to ensure the comfort and safety of every mother and baby. In fact, we are proud to announce we have been designated an official baby-friendly hospital. So let's start our tour, and again, welcome to New York-Presbyterian, Queens.
Hello, I'm Dr. Ashleisha Dial. Thank you for trusting us to care for you and your baby at this most important moment. From family-friendly labor and delivery rooms to state-of-the-art neonatal medical facilities, to skin-to-skin bonding and rooming in so the baby never leaves the mother's side. It's all to ensure the safety, joy, and comfort of the mom and her baby. Let me take you on a tour of our hospital. First, we will talk about what to expect in what we call labor and delivery. Then we will talk about what to expect after your baby is born, what we call mother and baby. Lastly, should your baby need additional care, we will show you our specialized neonatal intensive care unit. No matter what happens during your delivery, we are prepared. We can't wait to see you, your family, and your new life as you start this new and exciting chapter. When you arrive at the hospital, we ask that you come to the emergency room entrance. This is the fastest and highest priority entrance to our facility. It's also directly across from our parking facility on Booth Memorial Avenue. Inside the emergency room entrance, you will be greeted by the registration nurse. And should you need translation services, we feature on-demand interpretation in more than 100 languages, a service that'll be available to you bedside during your entire stay. Next, you will be escorted to triage, where our nurses and physician assistants will examine you and your baby. There, the attending physician or physician's assistant with the triage nurse will determine your next step. Should you be ready to deliver your baby, you will be assigned to a private labor and delivery room. Here at New York-Presbyterian, Queens, all of our labor and delivery rooms are private rooms, and you and 2 support people will be able to stay in this room for the entire process. Here in your room, you will be seen by your dedicated labor and delivery nurse. The nurse will orient you to your new environment. A fetal monitor, which is a belt that measures the heart rate of the baby, will go around your abdomen. Additionally, there will be a contraction monitor, which measures the strength and frequency of your contractions. Together, these help ensure the safety of you and your baby by allowing your physician and the physician's assistants to remotely monitor your progress. Once you're settled in, you and your nurse will discuss what kind of birthing experience you might have planned with your provider and family. The OB team will do its best to honor your wishes and address your concerns. Of course, the safety of you and your baby is our first priority. Importantly, and in conjunction with your birthing plans, we will ask every mother to rate her pain. This will happen regularly and at every stage in your labor. The nurse will then partner with you and the rest of your care team to offer the best pain relief for your stage of labor and your personal desires. When you become fully dilated at 10 centimeters, your nurse will coach you on how best to push to deliver your baby. The doctor will come in periodically to check progress towards delivery. A PA or a doctor will assist you in delivering the baby and the placenta. And of course, your loved ones can stay with you for this moment. After delivery, your new baby stays right with you, skin to skin, to ease your baby's adjustment to the outside world. Skin-to-skin contact is beneficial. It maintains your baby's temperature and blood sugar. It regulates your baby's heart rate and breathing and profoundly bonds you and your baby together. If your labor is not progressing, your physician may decide to perform an unscheduled cesarean delivery. In this case, you will be taken to the adjacent labor and delivery operating room. Here, you will meet the surgical team who will work to deliver your baby safely via cesarean section. After delivery, the baby is promptly assessed by a separate neonatal team. Then the baby is returned to the mother as soon as possible when both are stable and then transported together to the recovery area where skin-to-skin bonding will begin. And of course, should the mother or baby need intensive care, our obstetric and neonatal specialists are always available. Well, take a deep breath, because now you've delivered your baby. This is the most important time to get to know your baby. And if this is your first child, to get to feel comfortable in your new role as mother, as caregiver to an amazing child. At New York-Presbyterian Queens, we understand this thoroughly and have created a set of baby-friendly initiatives. Once your baby is born, you will stay in your labor and delivery room for approximately an hour and a half to 2 hours. This will allow for routine monitoring of both the mother and the baby. When ready, the nurse will bring the mother and baby down in a wheelchair to mother-baby unit. Your trip will be on a stretcher if you delivered by cesarean section. On the mother and baby unit, you will be assigned to a new room. Note that the standard room in mother and baby is a semi-private room, that you will share the room with another new mother. However, the hospital has private rooms and private suites available should you prefer. We will give you the details of reserving a private room in a few minutes. Once you've settled into your mother and baby room, there are routine visits and procedures. Here's what to expect. Your stay in the hospital will be for 2 nights for a vaginal birth and 3 nights for a cesarean delivery. Throughout your stay, your hospital staff will regularly visit you and your baby to make sure all is well. These visits are a perfect opportunity to ask any questions you may have. Our goal is to communicate and explain to you in a clear and understandable way. Here at New York-Presbyterian Queens, we understand and promote the benefits of breastfeeding. Each and every nurse is fully trained in breastfeeding assistance. Additionally, we proudly offer special breastfeeding support from our board-certified lactation consultants. Not only will you be supported throughout your stay, this support is available to you after you're discharged. You will get a menu to order your breakfast, lunch, and dinner. Each meal will be delivered to your room, fresh to order whenever you want on your schedule. Within 24 hours of birth, every baby will receive what is called newborn screening. This includes a hearing test, a cardiac test for congenital issues called critical congenital heart disease, a jaundice test, and a test for phenylketonuria, or PKU. Do note that the PKU will involve drawing blood from the baby. Every family will get a baby information pack. Inside this pack is a birth certificate form, a guide to the newborn channel on the TV, and other vital care information, such as breastfeeding resources, at-home formula preparation, and general information on newborn care for the baby and postpartum care for the mother. Every mother will attend a discharge class the day before their scheduled discharge. These classes are led by our specialized discharge nurse and will focus on what it's like to be the caregiver of your baby in your home environment. Class is held daily at 12:30 p.m. in Mandarin and 1:30 p.m. in English, and by bedside interpreter device in over 100 languages when necessary. Here, you will receive a discharge envelope with all your health information during your stay. Prior to discharge, every mother will be seen by an OBGYN physician or physician assistant, and every baby will be seen by a pediatrician. Follow-up appointments will be made for both. If further testing or blood work is needed, it will be done at this time. Should you or your family have questions about your stay at the hospital or what to do when faced with a medical decision, we have trained patient advocates available to help you navigate any situation and to feel assured you're making the best decisions for your baby and yourself. As mentioned, the standard accommodation in the mother and baby unit is a semi-private room. This is due to insurance reimbursement. We do proudly offer a limited number of private rooms and suites available at a reasonable cost. The private room allows you to have your significant other or support person stay overnight at your bedside. The suites also include a celebratory meal for two the night before you leave. The cost of the rooms are as follows. After your baby is born, you may reserve one of these rooms, and payment in full is due at that time. Insurance, as a rule, does not pay for the additional cost of these private rooms. Sometimes a newborn needs intensive care. At York-Presbyterian Queens, we offer a high level of intensive care for babies as young as 24 weeks. We take great pride in this unit, which is run by dedicated physicians, nurses, physician assistants, and technical and general staff. And because any baby may need intensive care, we are here to assist before, during, and after delivery. Our NICU is a level 3 NICU unit. This means we can care for very small or unusually challenged infants. We feature an entire array of life support, respiratory assistance, surgical care, and infection-fighting capabilities. Should your newborn require extraordinary care, you can take comfort that we are part of the New-York-Presbyterian network, and you have immediate access to the specialized care required. For a mother whose baby needs special care, we will do our utmost to support her. Mothers enjoy unlimited visiting privileges in the NICU next to your baby's bed. Mothers are encouraged to stay for rounding and ask questions they may have about their baby's progress. And of course, breastfeeding is encouraged and supported in the NICU. We also offer a support group for mothers and will assist you in monitoring and recording your baby's progress and milestones, no matter what the circumstances are. Now comes that wonderful moment when you as a mother leave the hospital with your new baby. Our discharge time from the hospital is 10 a.m. to 12 noon. At the time of discharge, your bedside nurse or discharge nurse will review your discharge paperwork, which includes your scheduled follow-up appointments, and request a signature. Once you and your baby are cleared to go home and transportation has been scheduled, please advise your primary nurse so they can arrange for a wheelchair to take you to the lobby at the front desk. Note, the front desk lobby is a different entrance than the ER entrance you arrived in. Remember, you must have a car seat for the ride home, but we do ask all families to please leave the car seat in the car. Rest assured that although you may have left the hospital, we at New York Presbyterian Queens are still here to serve you and assure the health and happiness of your family. You will have access to breastfeeding help and, of course, can consult with your attending physician or pediatrician about any other concerns you may have.
We are very proud of the work that we do here at New York Presbyterian Queens to ensure the safe and caring delivery of your baby. From all our staff, we wish you the very best and thank you for entrusting the most precious moment of your life to our care.